Hello, and welcome back to Ask Your Pain Doc. In this channel, we talk about traditional and alternative treatments for pain. Today, we're going to talk about tricyclic antidepressant, including Amitriptyline and Nortriptyline. Please make sure you support my channel by subscribe. Let's do it. Tricyclic antidepressants are used to treat depression, bipolar disorder, and other conditions including chronic pain, fibromyalgia, and insomnia. Tricyclic antidepressant will increase the amount of norepinephrine and serotonin inside your brain and inside your spine. And what happens when you have higher level of serotonin and norepinephrine, then that can cause a better mood and it will help with the depression. Antidepressants are primarily used for mood disorder, including anxiety and depression, but they also had a place in treatments of anxiety disorder, personality disorder, and other neurological disorders. Mood disorders that could be treated including bipolar disorder, the disorder that you had hypomania and severe depression in a phasic rhythm, dysthymia, major depression or major depressive disorder, anxiety disorder, body dysmorphic disorder, the patients that are not comfortable the way their body presents, generalized anxiety disorder, or they call generalized anxiety, obsessive compulsive disorder, and also panic disorders. They saw that tricyclic antidepressant could also help with diffuse body pain, migraine headache, Parkinson's disease, and also other type of neuropathic pain. The examples of tricyclic antidepressants are clomipramine, amoxapine, amitriptyline, desipramine, nortriptyline, doxepin, trimipramine, imipramine, and protein. Like any type of medication, these medications, they also had some side effect. The most common side effects are dizziness and sleepiness, blurred vision, constipation, drowsiness, muscle twitches, nausea and vomiting, sweating, and also weight gain for a long period of time. Combining tricyclic antidepressant with other medication that affect serotonin level can lead to condition that cause serotonin syndrome. These potentially dangerous conditions occur when serotonin level is too high, and the symptoms are including anxiety, severe abdominal pain, change in the blood pressure, confusion, and severe sedation. Sometimes it can also to tremor and high fever. So when that happens, you should contact your doctor immediately. Tricyclic antidepressants are also a significant cause of overdose in the United States. Initial symptoms may start with dry mouth, blurred vision, urinary retention that you cannot go to bathroom, dizziness, vomiting, and hallucination. If this is left untreated, overdose can cause severe delirium and also death. Tricyclic antidepressant medications are very safe. You should consult your doctor before treatments with any of these medications. It can help with depression, sleep issue, and also chronic pain. I usually prescribe this to some of my patients that they also suffer from anxiety and depression, and they can't sleep at night. I hope you've learned something today. Have a wonderful day. Don't forget to subscribe to my channel and turn on notification. Stay tuned. Please send me your feedback and comments, and I will see you all soon. Have a great day.